with Dr. Ethan Kreisworth and Toki Nakazawa. Uh, you know, in athletic training, joint dislocations have been kind of a taboo subject, and whether we should be doing them or not. So I wanted to have Toki on, who's created a company that creates joint relocation simulations, and then Dr. Ethan Kreisworth, who is sometimes the master at relocating joints with his company, Black Belt Sports Medicine. So welcome to the podcast. Uh, as I mentioned, Dr. Ethan Kreisworth, he's in Southern California, and he's the owner of Black Belt Sports Medicine, which contracts with different jiu-jitsu events and provides athletic training. Toki's in Texas, and he's the owner of MN Medical, specializing in creating and supplying medical simulation products to improve individual performance and the entire profession of sports medicine. So, Toki, what inspired you to create this joint relocation simulators?
So, I was the rookie one point, and I had actual reduction, and I had to do on my own. And I was glad because there was no doctor on site, and there was like a away game, and that kind of situation forced me to do it because if there was a doctor on site, doctor would do it. So I lose my opportunity, but that happened, and it's like they got through something to practice reduction technique, like a CPR mannequin. It's a medical simulation product. So it got to be something for sports medicine ortho. Couldn't find it. So one day I was a little tipsy and it's like, you know what, I'm gonna make my own. So that was the start. Yeah. So and then I went to so many places like Lowe's and Home Depot, and I got like 50 different springs. My product is low tech, and it's just I use wire and spring to recreate the tension. So I got like 50 really, really 50 different kind of springs. I've been trying so many. So, but yeah, I made it. The shoulder model was created 2013, and then 3 years ago elbow model, and then 2 years ago finger model. And I'm working on hip dislocation simulator right now. And after that, I'm going to TMJ and also ankle model with pulse function. So
Very cool.
yeah.
Awesome. That's great. That's a great idea. The subject of what you're doing now, you saw a gap and you utilized and you took advantage of the gap, because I totally agree with you. There is no practice. Practice is on the human.
Exactly.
When you get the chance to actually practice, if you're not fearful of any type of reprisal that may come through litigation. So it's a great opportunity. So I commend you on the product. It's awesome.
Yeah. The any basically just there's no confident, just fear and hesitation because you never practiced. So
Mhm.
I'm trying to reverse that. So and it's working. The athletic training program, the KD standard study 2020, they have to teach reduction technique all of a sudden, which is like, all right. I have been reducing it for 20 years. Finally, they're catching up.
That's great.
Yeah. So, and AT program is my target. But now I'm sending to medical schools. Actually, this morning I had the chat with the medical doctors and the doctor medical school in New York, and they asked my advice. And I mean, it's and also I sold to actually the nursing program. Some nursing program student, they're going to the nurse practitioner, and also they're going to decide to go to the like ortho clinic. So they purchased my model, which I kind of surprised, but like there's no risk here, so why not?
Yeah.
Mhm.
Well, Ethan, so with as many joint relocations that we've seen on the mats, when you became certified, did you start relocating right off the bat, or did it take you a while to get comfortable with it?
Yeah, when you invited me to the podcast, I tried to remember my first reduction, and I can't remember. But I do remember this. When I was a student at Cal State Dominguez Hills, we did our rotations with an ortho through the School of Health and through rotations at the health center. And that orthopedic surgeon, this was 91 or 92, so a long time ago. And he said, Ethan, would you reduce a shoulder if you had an opportunity? I said, no way. He said, why? I said, because we're not taught to. We don't know how. We're fearful of it. We're told not to. I mean, even I'm lecturing on the shoulder right now in a class I teach in sports med, and even says in bold letters in the PowerPoint, do not attempt a reduction or relocation of a joint. And I'm teaching dislocations, which is crazy to me. So I totally agree with Toki right there. Um, I can't remember when, but this was pizza surge, and the only one basically pushed that Ethan, if you have an opportunity, they're going to sit in the ER for 90 minutes to 2 hours, or they're going to be transported. It's going to take forever. So there's compromise, potentially vascular compromise or neurological compromise. Then why wouldn't you attempt? So he put that in my head early on as a student. So when I did get the opportunity, and I'm sure it was jujitsu that I attempted a shoulder because shoulders just want to reduce by themselves. There's so much negative capsular pressure that these joints just want to go in. And since we're on the mat, Shelby, so quickly, you're talking 10, 20 seconds. These things, sometimes they just even self-reduce. I mean, a little bit of traction in the most loose pack position, if you know those per joint, they want to go back in. And I call it negative pressure. So as I teach these students, I'm big on that idea. So I'm sure my first opportunity was the shoulder, if not a finger. And then, I got euphoric on that, just like I get euphoric on suturing people. I've pushed athletic training envelopes with the suturing idea. Are we allowed? When are we allowed? Now, Katie standards are allowing us to teach these reduction techniques, allowing us to teach these suture techniques. When can we actually implement them, right? And that's our biggest issue. Like, if you're going to teach us or allow us to be taught this information, we should be able to implement this information. So people are still scared. As you know, Shelby, we have a lot of students or a lot of certifieds, even doctors who come to our events are a little bit hesitant. And we saw at the last Worlds, some doctors they don't have the practical skills yet, even though they're MDs or chiros or high level practitioners, because they just haven't seen them as much. So I don't know. I always say, if you feel crepitus, stop. If you don't feel crepitus, you feel a lot of tension, keep going. And that's really my go-to right there.
Well, do we know how doctors in the ER or orthopedics, how do they get their reps on relocating joints, I guess? Does anybody know?
Well, they usually send those to the football games, high school football games, and hopefully they get to see it, and hopefully they get to practice. But still, it's hit or miss, not 100%. So yeah, so that's why I was on the social media. When I market my product, you don't need to send the resident to the football game anymore. Just you can teach them in the classroom. Sounds like, what do you mean? It's like,
yeah,
but
yeah. I mean, I would say it is hard talk. Is it Toki? Toki.
yes, Toki.
Toki. Yeah, it is hard, right? I think just like you made a really good example of, the CPR mannequin, right? So doing CPR on the CPR mannequin is a great way to practice. When it's live and you have a human, man, it's a whole nother level.
Yeah. Yes.
But I do think it's a great idea to get your hands on and feel tension. And it's just scaffolding. So we scaffold the next level of getting your hands on something that you actually can apply, and the next level is trying it on a human being, which is we have a lot of psychosocial factors involved in that too, right? So I would say one of the few joints I haven't reduced yet would be a hip. So that'd be a fun practice.
Go ahead.
Yeah, hip. I have a hip coming up in hopefully 3 months on the market. So yeah, well, I will come up and I'll let you play with it.
Okay, cool. Yeah, we have had multiple mandibular dislocations from jujitsu, so I've had my hands on, of course, ankle, toes, patella, shoulder, elbow. I think
Elbow is the one I see. When I read some articles, and now I think you have more elbow dislocation from jujitsu. I mean, it's jujitsu tournament every weekend. I mean, schools popping out like crazy in San Antonio right now. So
yeah,
which is good for the trainer or a healthcare provider to practice actual one. But you know,
yeah, yeah. Just your standard food mechanisms. I think they just do just about everything. So that's what we see. But yeah, when you have a screaming patient with screaming fans and everything else, it's definitely a lot of pressure. And we saw one just recently, and Shelby knows this. She was there. We were in Vegas at Master Worlds, and we had one that just would not reduce. It took three of us to reduce it. Three of
elbow.
us. Elbow.
Is that the one I mixed?
What's that?
Yeah, I think that was the one where we were all
Okay.
pulling on it, and it
Yeah.
finally went.
I mixed
And the doctor's kind of
that was a
poking on
YouTube
it.
video, and I mixed it. I put my reduction practice one on
Oh, that's right. Yeah, you're right. That's right. Yeah,
right. Okay.
we had me hanging on it, and
Yeah.
I put fulcrum underneath his that person's elbow, the patient's elbow, um, and then we had an MD pushing direct pressure down on the electronon posterior dislocation, and then we had two people hanging on the distal
Yeah.
forearm. I
Okay.
mean, that took everything.
Yeah.
So imagine. So, and here's the thing: is we're trying to reduce. We have people yelling at us over the stands, like "Stop that! Try harder!" Every the medical doctor, right? And then when we post Toki, when we post, then you see the plethora of people saying, "What are you doing? Great job! This is horrible. You guys are doing wonderful." So you
Yeah.
really have to like take a step back and say,
All right.
"Okay, I open myself up to criticism here. I put it out there. Is that good or is that bad? I don't know. It depends on
Yeah.
who."
I mean,
Yeah.
same thing. Is just you don't do X-ray and reduce. I work for high school. I don't have X-ray vision. Well, I might have it now, but it's like
You're
you reduce it without X-ray.
right.
That's crazy. You should send it to the ER. It's like no. I will
Sure.
use my educational, knowledge and then do the steps. And then if you like when you say, you don't feel cryptius, and then just
Mhm.
do it. That the age I hate, do not like is 13, 14 years old football player come off the field holding the shoulder like, oh my god,
Yeah.
you
Yeah.
know. But other than that, I reduce.
I would say too that I had my hands on a few number of broken ulnar radius, and when I tried to relocate, I just felt so much crepitus.
Yeah.
Wrists, one was a elbow, and one was a shoulder, and all came back as one was a humerus with a spinal fracture, the other one was a green stick fracture, and the wrist was just a comminuted fracture.
Oh,
So,
you.
but I felt, and that was the difference. That's when I said, "Aha, okay." I am feeling and hearing
Yeah.
crepitus. But hands off right away, splint, refer. And I would
Right.
say too, is anytime we try to reduce, and this is for Shelby's viewers, we always want to refer them, make sure everything clears out with their X-ray and they have good proper sensory motor and neurological control. So
Yeah. Well, because
yeah,
that's where we see at the jujitsu events is usually they don't have insurance. First off, they're international, so it's making them as comfortable as possible, and then they kind of have to make the decision after that. We give them all the red flags of if your hand starts going numb, if it goes cold, all you can do is educate them at that point. Because I mean, even if you send somebody splinted up with the dislocation, who knows if they're going to go to a good or if they're even really going to go to the doctor and get it relocated sometimes.
yeah. And I would say, if they're going to a ER or a clinic and they're not triaged because they're LOC times 4 and they're not shocky, then they're going to sit in the ER. They're just going
Yeah,
to
Yeah,
sit.
they're
three,
stable.
4 hours. Yeah, they're gonna stay, and then
Yeah,
finally, then it's time to see. Oh, you have to call the anesthesiologist,
yeah,
and then okay, then you get the bill a week later. Oh, it's the outer network anesthesiologist. Actually,
yeah.
they are on the network on purpose so they can bill whatever they want. That happens
Yeah.
all the time.
Yeah,
You
so
know.
that goes to Shelby's question is, when are we going to say it's okay to try to reduce, right? Within our plastic acts. So that's really, really hard. It's a big question and I don't know the answer, but it's a very big question. And I think most people now, I would say, athletic trainers who've had a number of years under the belt are probably reducing fingers and shoulders. They may not be reducing mandibles and ankles, maybe patellas, but you know, we the thing about athletic training and the stuff that we do, Talkie, is just we have massive volume,
Yeah.
massive volume, and then we always say it's like I talked to Shelby. I said we need MDs here. MDs will get more reps at jiu-jitsu tournaments than they will at 12 weeks, 14 weeks of football.
Oh yeah.
They will, you know.
Yeah.
So,
So that
so
I mean, when I see athletic trainers, high school setting, if they work, they manage to survive 5 years. I would say you'll be fine. You can be alone. You can cover anything, and you'll be fine.
yeah, yeah,
But some, if you're first year, second year, just they don't have enough reps, so they're not confident.
that's right.
Yeah. So do you guys see any misconceptions out there about the relocations? Obviously, people are scared, but what are some of the myths out there?
Some, when I go to the conference, some say, well, my state does not allow me to do, which that's fine, I get that. But some say, well, my doctor said, because of nerve damage, I'm not doing it. Because you're athletic trainer, we work under the doctor, so we can't do it. I get that. But, nerve damage, to me, it's like, what about it? Okay, shoulder, 11 to 30% axillary nerve damage possible. But if you know it, if they cannot raise their arm, documentation and reduce it. Same thing as elbow. Okay, if you notice there's nerve damage, okay, documentation, use your phone, record a conversation, protect yourself, and reduce it because it needs to be reduced. Sooner reduced, it's easier. Sooner reduced, patients suffer less pain. Sooner reduced, faster recovery. But people, they don't see that. Well, I don't, my doctor said I can't do it. It's like, no, So I don't argue with them. Okay, I understand that. But
Yeah, I don't understand. I mean, I don't know the data as far as neurovascular compromise because that's the biggest red flag is neurovascular compromise. You're going to put them in a worse state than they're already in. But I don't know the data. Like, and I haven't seen any massive data popping up in front of my face saying that this person suffered, lack of motor, lack of feeling, poor blood flow issues related to a reduction done by an athletic trainer. So I don't know the risk, but then again, I don't know the data deep enough. I would say, we have a lot of people out there reducing, in the means the on the field play. We have a lot of people doing, grade 5 manips with little risk, so I don't see a massive risk, but maybe I'm speaking too forward without reading the data.
But at the same time, I get that. When I was, a freshman trainer, I was scared to death to do it because shoot, what if I get sued? I got no experience. I got nothing to say. I'm scared to death. So after 5 6 years, I'm